What if one woman's research could save millions of lives and transform the way an entire nation cares for its children? This is the remarkable story of Fiona Stanley, Australia's quiet revolutionary in public health. Fiona Juliet Stanley was born on the 1st of August 1946 in Little Bay, New South Wales, Australia, into a family with strong academic and scientific roots. Her father, Professor Neville Stanley, was a microbiologist who would later become the founding professor of microbiology at the University of Western Australia. Her mother, Vera Stanley, was a psychologist. This intellectually stimulating environment profoundly influenced Fiona's worldview and instilled in her a lifelong dedication to scientific and humanitarian pursuits. In 1956, the Stanley family relocated to Perth, Western Australia, where Neville took up his professorship. Fiona attended St Hilda's Anglican School for Girls, where she excelled academically and showed early promise in the sciences. From a young age, she was inspired by stories of scientific pioneers like Marie Curie and developed an early awareness of the potential for medical science to save and transform lives. Her father's work in the eradication of polio also made a lasting impression on her, further cementing her interest in public health. Fiona went on to study medicine at the University of Western Australia, graduating with a Bachelor of Medicine and Bachelor of Surgery in 1970. It was during her early clinical work as a pediatrician that she began to perceive the limitations of treating individual patients without addressing broader systemic issues. She saw the devastating effects of preventable diseases and social disadvantage, which prompted her interest in the patterns and causes of illness on a population level. Seeking to equip herself with the tools to better understand these patterns, she traveled to the United Kingdom to undertake postgraduate studies. At the London School of Hygiene and Tropical Medicine, she earned a Master of Science in Social Medicine in 1976. There, she was introduced to the disciplines of epidemiology and biostatistics, fields that would become central to her life's work. Upon returning to Australia, Stanley joined the Western Australian Department of Health as a senior medical officer in child health. She later became Deputy Director and Principal Research Fellow at the National Health and Medical Research Council, or NHMRC, unit in Epidemiology and Preventive Medicine at UWA. Her training in epidemiology equipped her with the ability to use data to uncover the hidden causes of disease and social disadvantage. She recognized the potential of linking population data sets, such as birth, death, and hospital records, to understand the determinants of health. This approach was revolutionary in Australia at the time and became a hallmark of her career. One of her earliest and most influential achievements was identifying the importance of folic acid supplementation in preventing neural tube defects such as spina bifida. Through rigorous population-based research, she and her colleagues demonstrated the need for improved nutrition among pregnant women. This work directly influenced changes to public health policy, including the fortification of food with folic acid, a measure credited with drastically reducing the incidence of such birth defects. In 1990, Fiona Stanley founded the Telethon Institute for Child Health Research in Perth, a groundbreaking institution that combined research across multiple disciplines to tackle the complex determinants of child health. She served as its director until 2011. The institute was established with a clear vision to create a collaborative environment that brought together biologists, clinicians, sociologists, and policy experts in the pursuit of better health outcomes for children. Under her leadership, the institute gained a reputation as one of the most innovative research centers in Australia. It focused not only on biological causes of disease, but also on social and environmental factors. Issues like Indigenous health disparities, developmental disabilities, mental health, and the effects of early childhood experiences on long-term outcomes. Stanley's approach was inherently holistic and deeply humanistic. She emphasized the importance of early intervention, data-driven policy, and cross-sectoral collaboration. Her work revealed the lifelong impact of early childhood disadvantage and advocated for preventive strategies rather than reactive treatments. One of Stanley's most significant contributions was her unwavering commitment to improving the health of Aboriginal and Torres Strait Islander communities. She was among the first scientists in Australia to draw national attention to the devastating health inequities faced by Indigenous Australians. Her research highlighted alarmingly high rates of infant mortality, low birth weights, and chronic disease in these communities. Rather than merely publishing statistics, Stanley sought to empower Indigenous voices and foster community-led health solutions. She worked closely with Aboriginal health workers, respected Indigenous elders, and community leaders to ensure that health research was culturally sensitive, ethical, and beneficial. Her advocacy was instrumental in creating national awareness and policy shifts aimed at closing the health gap. Fiona Stanley's ability to interpret scientific data for the broader public and policymakers made her a leading figure in national health debates. She often served as a bridge between researchers and governments, translating complex epidemiological findings into actionable public policy. Her expertise was sought by numerous governmental committees, including her role as chair of the Australian Research Alliance for Children and Youth, which she helped establish in 2002. In public addresses, she often spoke about the urgent need for upstream solutions, policies that address the root causes of poor health, including poverty, education, nutrition, and housing. She also became a strong advocate for social investment in early childhood, arguing that the first few years of life are critical in shaping a person's lifelong trajectory in health, education, and well-being. Fiona Stanley's immense contributions to science and society have earned her widespread recognition both nationally and internationally. In 1996, she was appointed a Companion of the Order of Australia, the nation's highest civilian honor, for her service to public health, research, and the promotion of child and maternal welfare. She was named Australian of the Year in 2003, a title that brought her message of early intervention and child welfare to the forefront of public consciousness. In accepting the award, she emphasized the need to invest in our children now or pay later, highlighting her lifelong message that prevention is not only more compassionate, but also more cost-effective. She has received numerous honorary doctorates from Australian universities and was elected as a Fellow of the Australian Academy of Science in 2002. In 2004, she was named an Australian Living Treasure by the National Trust. In 2019, she was elected an International Honorary Member of the American Academy of Arts and Sciences, one of the world's most prestigious scholarly societies. In 2014, Western Australia honoured her legacy by naming its flagship tertiary hospital the Fiona Stanley Hospital. Located in Perth, it is one of the largest and most technologically advanced health campuses in the country. The naming of the hospital serves as a testament to her contributions to medical science and public health. Despite stepping down as director of the Telethon Institute in 2011, Stanley remains active in public life. She continues to speak and write about child development, social inequality, and health policy. She is also a vocal proponent of data sovereignty and ethical research practices, particularly as they pertain to Indigenous communities. Fiona Stanley's legacy is one of vision, courage, and compassion. She transformed child and maternal health in Australia through a unique combination of scientific rigor and moral clarity. Her work has saved countless lives, improved the health of generations, and influenced public policy at the highest levels. She showed the power of science not just to understand the world, but to change it for the better. More than a scientist, she is a nation builder, a figure who has worked tirelessly to ensure that all Australian children, regardless of background, have the chance to live healthy, meaningful lives. Her story is a beacon for anyone who believes in the power of evidence, equity, and empathy. Fiona Stanley showed us that science, driven by compassion, can shape a healthier, fairer world. If you found her story as inspiring as we did, don't forget to like, share, and subscribe, because we've got more untold stories of changemakers coming your way.